Nathali at the Endometriosis Summit, and she came up to me after I spoke on a panel with the hosts of the Endo Summit and told me that she wanted to be seen, and then she came into the office in Manhattan.
I was really lucky that Dr. Sally Sorrell was actually my pelvic floor therapist at the time. And at the first visit that I did with her, which was an amazing moment in itself because I had somebody that really validated my pain, understood where I was coming from, understood my concerns, she did an assessment and she said, I think you have nerve compression from hernias, which a lot of people don't know. It can be something associated with long-term endometriosis. And she recommended nerve block injections, which she then recommended Dr. Ahmed for. And I absolutely did pursue that post-excision.
So majority of the patients with endometriosis either think they have endo or know they have endo by surgery or have been told that they might have endo clinically. I was treating Nathali for her endometriosis, but alongside her pelvic floor dysfunction, as well as nerve pain she was having in her groin.
I got diagnosed within the first year of me looking for answers for my symptoms. It was pretty relentless. It was my 7th doctor visit that I had a gynecologist say endometriosis to me and not invalidate my pain, not tell me that it was all in my head, not tell me that it was normal. And they knew enough to do a laparoscopic ablation, which we know ablation is really not the most effective treatment for endometriosis. I didn't know that at the time. I made the decision that I best felt I could do then before I learned so much about what endometriosis actually is. And he kind of just told me, we're going to do this surgery. I have to do a biopsy, and then we'll determine if you actually have endo. And said and done, the biopsy came back. I did have endometriosis, and he told me he ablated most of it and just left some of it behind because he didn't want to touch it. He told me that I would just have to live the rest of my life in pain, that he felt really sorry for me, that I should really try to get pregnant as quickly as possible. I was 21 years old, and that was really not at the top of my to-do list. And he told me if I didn't get pregnant by 30, that I would be infertile. And he said just that when I was ready to come to him for a hysterectomy, because that would be the best course of treatment for my endometriosis. And he was my gynecologist for a very long time. And every year when I would go for him for my annual checkup, he would say, what are you waiting for? Like, when are you gonna have kids? Like, it'll actually relieve the pain if you have children. We have to schedule a hysterectomy as soon as we can. And every year my pain did get worse. The ablation surgery maybe provided relief for about 3 to 4 months, but then I was just in excruciating pain. And over those 11 years, because that's how long it took for me to find the appropriate care, it went from, fainting in public was just something that I was good at. Like, I would know when I was gonna faint from pain and just kind of made sure that I would lay on the right side. I've passed out, on my way to work, on the street. Nobody, thankfully, did anything to me. But I would just get up, go to work. And even if I was in blinding pain, I didn't have the privilege really to not work or not go to school. So I just pushed through it and I would shake it off, and nobody really knew what I was dealing with, especially because I was so ashamed of the pain. I felt like I'm first generation Central American. My parents have worked so hard in this country just to give me the opportunities that I have. So I felt like complaining about my pain or even talking about my pain or even implying that I needed rest was unfair to them. And I had to push through all of that. So, my friends kind of already knew that I dealt with painful periods. That's what everybody called it. I also thought that that's what it was. My sister, it makes me a little emotional. She is 7 years younger than me, but she would know that around that time to boil water, put it in a Ziploc bag and hand it to me, which I don't recommend anybody does. But that was really the only way that I would get relief because over-the-counter medication didn't work. What the doctor was prescribing to me didn't work either. And I just dealt with the pain for a long time. And then I found Dr. Sally Sorrell because I was told that I had pelvic floor prolapse, and that's the diagnosis that I got from my gynecologist. It wasn't true, but I knew that a pelvic floor therapist would deal with it. I didn't know that that profession even existed, pelvic floor therapy. And when I saw Dr. Sally Sorrell, she, in her initial assessment, was like, you don't have organ prolapse. What you actually have is pelvic floor dysfunction. You have a really tense pelvic floor, and that's the symptoms that you're feeling. And she's like, the tightness, the pulling is actually that pain. And when I would point to my uterus pain, Dr. Sally taught me that it was actually my bladder. When I would point to my ovary pain, Dr. Sally actually suspected that it was an inguinal hernia. And it just kind of shattered my world that I had more pain than the endometriosis. I had no idea that pelvic floor dysfunction was a thing. I had no idea it existed. I didn't know what a pelvic floor therapist was. And I think that was the most frustrating part. Is I spent 11 years complaining about pelvic floor pain. I complained about pelvic floor pain to my gynecologist, my PCP. I did some physical therapy for a sports injury. Every doctor that I had, I would always tell them I experience a lot of pelvic floor pain, a lot of lower body pain, and unexplained constipation, which everybody would tell me was my eating habits. And I cannot tell you how much greens I've eaten in my life, but it would never get better. And it was just so frustrating that that's all it took was one assessment from Dr. Sally for her to say to me, you have pelvic floor tension. And no one ever told me that painful sonograms with a wand are not normal. That bleeding from those for weeks after, or cramping for weeks after, is not normal. I didn't know that painful sex wasn't normal. And those were all pointing to pelvic floor dysfunction, and no one ever identified that for me, which was extremely frustrating. And this is what I would wish every endometriosis patient had, is an endometriosis informed physician, because it doesn't have to be an expert excision surgeon. That's great if that's your first encounter with an endometriosis informed expert, but Dr. Sally is a pelvic floor therapist. And then she told me about the Endometriosis Summit, which she hosts every year with Dr. Nathali. And when I attended, Dr. Ahmed was actually a speaker there, and she was talking about pelvic floor pain and what pelvic pain rehab actually does for patients. And nerve block injections, suppositories, pelvic floor relaxing. I had never even heard of those things, or that it was even possible. So I was starting to get some relief from pelvic floor therapy, but Dr. Sally and I talked about it, and we agreed that probably excision was the next best step for me. So I had that scheduled 3 months after meeting her, which is incredible because I know how long it takes people to get that and to be able to do that. And I had excision. The excision was successful. I'll say that within a few weeks, I haven't had endometriosis pain since, but I was still in excruciating pain. And that was the biggest thing, was then pursuing pelvic pain rehab help, because now we needed to identify, why am I still in pain? Is it the pelvic floor dysfunction? Is it these suspected hernias? And that's what we did. We did nerve block injections to see if that would actually calm this uterus pain. And it did, because it was actually bladder pain. My genitofemoral nerves were compressed, and that's what was causing that pain. We did pelvic floor injections to help relax it, which I cannot explain the relief. It was almost like sorcery. I can't explain what it's like to live a lifetime in incapacitating, crippling pain, and to have one visit with Dr. Ahmed and have relief that you just didn't even know was possible, because the fact that I didn't have that nerve pain and I didn't have that pelvic floor tightness was mind-boggling to me. I mean, I post-excision, I was barely able to walk for more than 5 minutes because everything was so upset after the surgery. So I knew that this is something that I had to continue. Dr. Ahmed also prescribed suppositories that help with pelvic pain relaxation, topical creams for the nerve pain. Again, life-changing. I was able to go 1 day without pain, 2 days without pain, 3 days without pain, where now I'm at a point where my pain is sporadic. You can't undo a lifetime of tissue damage overnight. And I think that's the most important thing, is to be patient. Be patient with these therapies. Be patient with the nerve block injections and the suppositories. They do work. It's just you have to be patient. You have to be consistent, and it's gonna take time. But I am close to my 4-year anniversary post-excision. I am close to 3 years anniversary post-hernia repair, because I did have hernias. I had 7. I had 2 inguinal, 2 genitofemoral, and 2 obturator hernias, which all were compressing those direct nerves. And I wouldn't have made it without the nerve block injections or the topical cream. I was able to keep my job, which I know that a lot of patients are not able to. And so I am very lucky that I was able to get the help that I needed, because I was able to go to work and I was able to manage my pain. Like, something actually worked, which was incredible. And so working with Dr. Ahmed, consistent pelvic floor therapy, just understanding that yes, the endometriosis pain is gone, but if you're still experiencing pain, we got to find those other pain generators. What are they? And somebody like Dr. Ahmed can help find those things. She can kind of play, detective and figure out if we block something and it's helpful, then maybe we can check to see if it's a nerve compression. If we're doing pelvic floor injections and it's helpful, then we have to continue pelvic floor therapy. And what I love the most about Dr. Ahmed is that she is an advocate for her patients, and she was in contact with my pelvic floor therapist, my personal trainer, basically anybody I asked her to speak to, she would do it. And she would make sure to let them know what my profile was like, because the excision surgeon did his job. He's not the person I'm going to go to anymore. Dr. Ahmed seeing me consistently. And so it's been really amazing to see my progress from when I started to where I am now, where I very sporadically use suppositories, because I'm on a powerlifting team now. So I went from not being able to walk to being able to powerlift, which is like my love. It's something that I love doing. It's something I couldn't do for so long. And that's something that's so difficult with living with chronic pain, is that you can lose parts of your identity because you just can't do those things anymore. But with the patience of just trusting my doctors and trusting my team, I was able to get back to a point where I could lift weights and work up to powerlifting, and that's what I do for fun now. And really important is I had kind of lost my fashion. I had kind of lost the way that I liked to dress, which was really depressing, because I love high heels and I love getting dressed up, but that was something I could never do before. But after a few weeks of pelvic floor therapy, injections, and suppositories, I can wear high heels all day at work and feel really cute and feel really good about myself. And I don't think people understand how important that is, or even dancing, right? Like, I couldn't dance for so long because it would literally trigger such terrible flare-ups. And I'm Latina. Culturally, we love to dance. It's something that you do with your family, with your friends, and I'm able to do that now. So I have most of my life back, is what I'll say. And the better part is I have the mental tools and the physical tools to be able to deal with whatever comes my way. And, I encourage just every endometriosis patient to continue to look for the care that you deserve, right? If you've had excision, that's amazing. Expert excision is fantastic. It's the first step, but it's not the final step. You have to remember that it took years to get like this, and it's gonna take a long time also to bounce back from it as much as you possibly can, and accept that some things may not come back 100%, but you can live a quality of life that you deserve. And I feel like that's happened for me.